Gabapentin is an anticonvulsant commonly used as an agent to treat neuropathic pain. Its mechanism of action is primarily due to effects at which of the following sites? A. Calcium channels. B. You are called to see a 5-year-old child in A&E who has respiratory distress. You note that she is stridulous, sitting in the upright position, drooling and using accessory muscles of respiration. She is febrile with a temperature of 39.5 degrees Celsius. Which of the following statements is correct? Her airway may be precarious, and she should be transferred to theater for intubation with an inhalational induction and avoidance of the use of muscle relaxant. E. You have been asked to The obstetricians have admitted a woman with preeclampsia to the high dependency unit. You have been asked to review her. Which of the following statements about preeclampsia is false? A. A systolic blood pressure greater than 170 mmHg on 2 occasions with proteinuria greater. Proteinuria greater. Spinal anesthesia is relatively contraindicated. Spinal anesthesia is relatively contraindicated. C. Spinal anesthesia is relatively contraindicated. C. Eclampsia. E19. Which one of the following would be most appropriate for the treatment of portal hypertension? A. OC. C. Bisoprolol. D. Propranolol. E. Propranolol. E. Propranolol. E. A 54-year-old female presents to the pain clinic with a 2-month history of episodic, severe stabbing pains in the left cheek. It can be brought on by innocuous factors such as light touch. There are no autonomic features. What is the most likely diagnosis? A. B. Trigeminal neuralgia. Trigeminal neuralgia. C. Trigeminal neuralgia. C. A 9-month-old infant is brought into hospital by his parents with suspected meningitis. The pediatric registrar manages to sight a cannula on the dorsum of his hand, but is unable to obtain a blood sample. On examination, he is difficult to rouse, cool peripherally and has purpuric spots on his lower leg. His temperature has been measured at 39.5 degrees Celsius. The next most appropriate action is E. Administer a dose of intravenous CEFT. Administer a dose of intravenous CEFTRIAXONE 22. You have just performed brainstem depth tests on a patient with a poor-grade subarachnoid hemorrhage. You have discussed organ donation with the family and the transplant coordinator is on their way. The nurse reports that she is having to increase the patient's noradrenaline infusion in order to maintain a MAP of 70 mmHg. What is your next action? A. Insert an oesophageal Doppler for cardiac output monitoring. B. You note that he has. On arrival to A&E, a 20-year-old cyclist is involved in a high-speed road traffic collision. On arrival to A&E, you note that he has some blood around his nose and mouth, and you suspect a facial fracture. His respiratory rate is 12/min, but the pattern is irregular. The heart rate is 100/min and BP 140 mmHg. Glasgow Coma score is 9/15, E2V2M5, pupils equal and reactive to light. He had a brief, self-terminating generalized tonic-clonic seizure witnessed on his arrival to the department. An arterial blood gas analysis gives the following results: PO2 12 Pa, CO2 6.0 Pa on 15 liters min O2 via face mask. Organize for. The next most important step in the management plan would be to A. Load the patient. C. Transfer the patient. D. Intubate and ventilate immediately. Transfer the patient. D. Intubate and ventilate immediately. E24, acute lung injury (ALI) and acute respiratory distress syndrome (ARDS) are common in sick patients, particularly in those admitted to critical care units. Knowledge of the pathogenesis and treatment of these disorders is important in intensive care medicine. Which of the following represents current knowledge of lung injury? A. Cardiomegaly is generally not a feature of ARDS. Which of the following represents current knowledge of lung injury? A. Cardiomegaly is generally not a feature of ARDS. B. E25, a general surgeon asks your advice on the management of a patient with inoperable pancreatic carcinoma who is currently an outpatient. The patient has severe abdominal pain that has failed to respond to a combination of paracetamol, diclofenac and codeine. Appropriate pain control interventions for this patient would not include A. Amitriptyline in escalating doses at night. B. Amitriptyline in escalating doses at night. B. Amitriptyline in escalating doses at night. E26. A 6-year-old child is booked for a tonsillectomy. The nurse informs you that they have been unable to weigh the child, but have managed to perform some routine observations. Which of the following is most consistent with a healthy 6-year-old at rest? A. Weight 25 kilograms, heart rate 100, breaths per min 20. B. Weight 25 kilograms, heart rate 100, breaths per min 20. B. He has a 46-year-old mechanic is referred to the chronic pain clinic. He has a 6-month history of altered sensation, pain and reduced function in his right hand. His general practitioner has diagnosed complex regional pain syndrome, CRPS. He has been prescribed amitriptyline, gabapentin and nifedipine. The pain has improved slightly and he is receiving no other treatment. What treatment would you offer first at clinic today? Request a course of physiotherapy. E28. A 56-year-old female is undergoing posterior fossa craniotomy in the sitting position for debulking of a claval tumor. 30 minutes after commencement of surgery, there is an abrupt fall in end-tidal carbon dioxide concentration from 4.5 Pa to 2 Pa accompanied by an audible change in the precordial Doppler signal. Which of the following interventions should be performed first? C. Inform the surgeon and ensure the surgical field is covered with saline-soaked swabs. Peripheral nerve blocks can often be used in place of neuraxial blocks, and may reduce the need for postoperative opiates and their accompanying side effects. Which of the following is true? A. Most operations on the foot can be performed under sciatic block. B. E. The LABA. E30. A 33-year-old previously healthy female with a history of moderate alcohol use presents to the emergency department with 2 weeks of abdominal pain, constipation, abdominal distension and jaundice. Blood results revealed abnormal liver function tests and deranged clotting. Paracentesis is performed. The neutrophil count is 330 mm. 3. The most likely diagnosis is A. Spontaneous bacterial peritonitis. E. F1. A 45-year-old male, ideal body weight 80 kilograms, has been admitted to the ICU with aspiration pneumonitis. He has developed ARDS. He is being mechanically ventilated, SIMF. Ventilator settings are as follows: FiO2 0.8 tile volume 760 ml, respiratory rate 10/min, PEEP 10 cmH2O, peak airway pressure 40 cmH2O, plateau airway pressure 37 cmH2O. Blood gas results are pH 7.35 PaO2 8.5 Pa, PaCO2 5.0 Pa, bicarbonate 24 mol, Lb -0.8, SaO2 90%. What would be the most appropriate next step in this patient's management? E. Reduce tile volumes and adopt strategy of permissive hypercapnia practice. K. University. F2. Paravertebral blocks are useful for providing analgesia for a wide range of surgery. They avoid many of the potential difficulties of neuraxial analgesia, but have potential complications of their own. Which of the following is true? A. Intrapleural injection of local anesthetic will result in severe impairment of respiratory function. Intrapleural injection of local anesthetic will result in severe impairment of respiratory function. F3. A 54-year-old patient has had a previous spinal fusion for spondylolisthesis. 5 years after the fusion, she presents with back pain radiating to her left foot with no effects on motor or excretory function. She has had appropriate conservative management including codeine. After 3 months she requires operation. The least useful perioperative pain management adjuvants for this patient would be A. D. Intravenous E. Intraoperative administration of nitrous oxide. F4. You are called to A&E to see a 35-year-old female with acute asthma. She is confused and exhausted. You perform a rapid sequence induction and intubate with a size 8.0 endotracheal tube, but are finding it impossible to ventilate her and the saturations drop to 75% on 100% oxygen. What do you do next? A. Check the position and patency of the endotracheal tube. B. Check the position and patency of the endotracheal tube. B. Check the position and patency of the endotracheal tube. B. Exhausted. You perform a rapid exhausted. She is confused. You are called to A&E to see a 35-year-old female with acute asthma. She is confused and exhausted. You perform a rapid sequence induction and intubate with a size 8.0 endotracheal tube, but are finding it impossible to ventilate her and the saturations drop to 75% on 100% oxygen. What do you do next? A. Check the position and patency of the endotracheal tube. B. Her parents, listed for revision. An 8-month-old infant with a Chiari type 2 malformation and associated hydrocephalus is listed for revision of a blocked ventriculoperitoneal shunt. Her parents say that she has been irritable, not feeding well and has vomited once today. Which of the following drugs would be best avoided during her anesthetic? D. Nitrous oxide. Sevoflurane. D. 8-month-old infant with a Chiari type 2 malformation and associated hydrocephalus is listed for revision of a blocked ventriculoperitoneal shunt. Her parents say that she has been irritable, not feeding well and has vomited once today. Which of the following drugs would be best avoided during her anesthetic? Nitrous oxide. E. Isoflurane. Significant component of pain experienced after abdominal surgery is related to the abdominal wall incision. Which of the following abdominal wall nerve blocks would be most suitable following total-abdominal hysterectomy via phalansteal incision? Rectus sheath block, transverse abdominis plane block, bilateral. 76-year-old male is admitted to the cardiac intensive care unit after aortic valve replacement. On the second postoperative day, he is diagnosed to have acute renal failure, ARF. Which of the following statements regarding the rifle classification for ARF is false? A. Failure, O less than 0.5 milliliters kilograms per hour for 12 hours. D. 85-year-old Afro-Caribbean woman has presented on your trauma list for reduction of Achilles fracture. She has a history of sickle cell disease and ischemic heart disease. Which of the following statements regarding intravenous regional anesthesia is true? At least 20 minutes should pass before the tourniquet is deflated. F9. Scoring systems are commonly used for patients admitted to intensive care. With regard to scoring systems in the critically ill, which of the following is true? A. The Simplified Acute Physiology Score, SAPS, is a first-day scoring system. C. Year-old male with advanced prostate cancer complains of severe thoracic back pain. An MRI scan reveals localized metastatic bone deposits which do not require surgery. His prognosis is a further 6-month survival. Which treatment would be most effective at treating his pain? A. Bisphosphonates. B. Radiotherapy. C. You are asked to anesthetize a 34-year-old lady for insertion of a transjugular intrahepatic portosystemic shunt. She is suffering from Budd-Chiari syndrome and has large tense ascites. She has no other past medical history and gives no history of reflux. The procedure has been attempted twice under local anesthesia, but she was unable to tolerate the procedure due to discomfort. Your anesthetic plan is to A. General anesthesia with an ET, a large IV access, invasive arterial monitoring and cardiovascular stability, with blood products available. F12, intraoperative cell salvage ICS, is a technique that allows the blood lost during a surgical procedure to be returned to the patient in an attempt to avoid risks of autologous transfusion. It requires the shed blood to be processed by a machine which filters, washes and centrifuges blood aspirated from the surgical site, to allow only the red cell component to be reinfused. Which of the following is an absolute contraindication to the use of cell salvage? D. Where substance is not like bowel contents in the surgical field. D. Bowel contents in the surgical field. D. Breathing spontaneously. F13. You are anesthetizing a 4-year-old child for unilateral squint correction. The child is breathing spontaneously on sevoflurane. Her heart rate drops to 40 bpm. The most likely cause is A. Traction on medial rectus muscle. B. 4-month-old baby has had diarrhea and vomiting for the past 3 days. Mom is worried because he has only had one wet nappy in the last 24 hours. His last weight was 8 kilograms on examination. His heart rate is 160 bpm, he is restless, has a sunken fontanelle and reduced skin turgor. Which of the following statements is most accurate? The child has 10% dehydration and his fluid requirement is, deficit 100 ml kilograms plus maintenance 100 ml kilograms per day. D. Spinal cord stimulation is a neuromodulatory technique used in the management of chronic pain. Which of the following conditions is most likely to respond to spinal cord stimulation? Refractory angina. F16. Laplace's law is relevant to both cardiovascular and respiratory physiology, relaying wall tension to pressure and radius in fluid-filled systems. Which of the following represents Laplace's law? D. Wall tension equals pressure times radius / wall thickness E. You are called to theater to provide anesthesia for an emergency cesarean section on a lady with an umbilical cord prolapse. Which of the following would be appropriate in this patient's management? D. Cricoid pressure of 20-40 N should be kept in place following induction, until confirmation of tracheal intubation. E. Marfan's syndrome is associated with many anatomical features. Which is not a feature of Marfan's syndrome? A. Aortic regurgitation. B. Aortic dissection. C. Patent ductus arteriosus. D. Descending thoracic aortic aneurysm. E. Arched palate. F19. With regard to intrathecal opioids, which of the following statements is true? A. Cephalate movement of opioids injected into the CSF is partly due to expansion and relaxation of the brain, occurring as a result of the cardiac cycle. B. COPT is associated with respiratory and non-respiratory effects. D. Hypoxia in COPT patients is due mainly to V/Q mismatch. Erythromycin tends to D. Hypoxia in COPT patients is due mainly to V/Q mismatch. F21. A 58-year-old lady is scheduled to undergo a coronary artery bypass grafting procedure with cardiopulmonary bypass (CPB). In order to minimize the risk of acute kidney injury, which strategy should be avoided intraoperatively? B. Autologous red cell transfusion. Autologous red cell transfusion. Autologous red cell transfusions. F22. Around 40,000 transurethral resection of the prostate (TURP) are performed every year in the UK. Mortality may be as high as 1%. Recognition of acute physiological changes is important in assuring quality of care for patients undergoing TURP. Which of the following is most accurate? Shoulder pain in patients who have had spinal anesthesia may indicate prostatic capsular rupture. E. F23. Carcinoid syndrome results from the secretion of vasoactive and other substances from certain tumors. These have systemic effects relevant to anesthesia. Regarding the anesthetic management of carcinoid syndrome? D. There is an association with right-sided heart disease, caused by myocardial plaque formation and endocardial fibrosis of the right heart valves. E. A 78-year-old man with chronic renal impairment, hypertension and peripheral vascular disease presents to the emergency department with abdominal pain. A CT scan shows a leaking, 7 cm juxtarenal aneurysm. He is cross-matched for 6 units of pat red blood cells and 6 units of fresh frozen plasma and given 1,000 milliliters of colloid. The blood products will be in theater in 10 minutes. In the anesthetic room, his blood pressure is 95/50 seconds, with a heart rate of 88 bpm. The surgeons are scrubbed. An arterial line is in situ. The next most appropriate step is E. Contact the transfer the patient to theater, keep him warm, but do not proceed with anesthesia until the blood products are in theater. E. F25. You are asked to sedate a 32-year-old man with severe learning difficulties for an MRI scan of the head. He is uncooperative and impossible to communicate with. There is a carer present who is able to assist. Which of the following is the most appropriate initial anesthetic plan to enable the MRI to take place? D. Administer temazepam 30 mg orally on the ward 1 hour before the scan, and then conduct an inhalational induction in the MRI suite using sevoflurane E. A 16-year-old male attends for an emergency appendectomy under general anesthesia. He undergoes a rapid sequence induction with thiopentone and suxamethonium. In recovery he makes no attempt to breathe or cough, he becomes tachycardic and hypertensive, and sweating and pupillary dilatation are evident. Anesthesia is maintained for 2 hours, at which point he begins to breathe. Which of the following is this patient's most likely genotype for plasmacholinesterase? E. U. Ia. Ia D. U. Fe. F27, you are scheduled to anesthetize a 78-year-old gentleman for an endovascular aortic aneurysm repair (EVAR) in the radiology suite. Which of the following is the most appropriate statement? E. Postoperative renal dysfunction is not infrequent. F28, a 65-year-old female is undergoing emergency laparotomy for suspected diverticular perforation. Feces are seen within the abdominal cavity. The blood pressure has slowly dropped and you have commenced noradrenaline following fluid resuscitation. SpO2 is reading 92% and falling, the peak airway pressure is 30 cmH2O having previously been 16 cmH2O. The trachea is shifted to the left. There is decreased chest expansion and a dull percussion node on the left-hand side with reduced air entry also noted on that side. The most likely diagnosis is B. Right-sided B. Right-sided endobronchial intubation. F29, a 58-year-old male with COP is undergoing oesophagectomy. A left-sided double lumen tube is inserted at induction. After 1 hour the SpO2 reads 88%. The pulse oximeter is placed correctly and there is a good trace. The patient is receiving FiO2 1.0, tidal volume 500 ml, respiratory rate 10, PEEP 5 cmH2O. What is your first action? C. Check tube position with a fiber optic bronchoscope. D. A 63-year-old man presents for arthrodesis of his ankle under general anesthesia. His has a history of heart failure, well-controlled hypertension and ischemic heart disease. He underwent balloon angioplasty 9 months ago. He can now walk half a mile at his own pace without getting short of breath or angina. He takes aspirin, clopidogrel, bisoprolol, ramipril, simvastatin and bendroflumethiazide. On arrival in the anesthetic room, the ward nurse tells you he has not had any of his medication that day, but had all of his drugs yesterday. The most appropriate next step is D. Return the patient to the ward to take his medication and reschedule surgery for later on the list. E. A 61-year-old gentleman attends the anesthetic preoperative clinic. He is due to attend for a total knee replacement in 6 weeks' time. His past medical history includes a mechanical mitral valve replacement 5 years previously and he is on warfarin. It is decided to discontinue his warfarin 5 days preoperatively. Select the anticoagulation strategy most appropriate for this patient in the 5 days before surgery. B. Give therapeutic dose subcutaneous low molecular weight heparin daily, administering the last dose 24 hours before surgery. A patient presents on your list for resection of an abdominal tumor of unknown etiology. Which of the following is most likely to be associated with a diagnosis of carcinoid disease? C. Intermittent flushing. D. A 23-year-old woman with myasthenia gravis is scheduled for thymectomy. She was diagnosed 3 years ago and currently has an FVC of 3.5. She is seen regularly in clinic, and is compliant with medical advice. Which of the following statements is most likely to be true? C. A non-depolarizing muscle relaxant will be required to facilitate intubation. D. Obstructive sleep apnea is associated with the following physiological changes, except A. Intracranial hypertension. B. Gastroesophageal reflux. C. Systemic hypertension. D. Core pulmonale E. Increased growth hormone G5. Core pulmonale E. Increased growth hormone G5, a 100 kg 34-year-old male presents with a 35% full thickness burn. He is admitted to critical care. Renal function begins to deteriorate, and 48 hours after admission his creatinine has risen from 100 to 350. Hourly urine output has averaged 25 milliliters hour 1 for the past 24 hours. According to the Rifle classification of renal dysfunction, this represents A. C. Acute renal failure. G6. You are asked to anesthetize a 5-year-old with cerebral palsy for repeat insertion of grommets. His mother tells you that he has recently suffered from another chest infection. He saw his general practitioner 14 days ago with fever and a productive cough, and was treated with a course of antibiotics that finished 7 days ago. At present, he is epirexial, his cough is much better, and non-productive. On examination, he has some quiet, bilateral wheeze, which clears with coughing. What is the most appropriate course of action? A. Discuss increased risks with parents and proceed to anesthesia if they give consent. B. A 22-year-old active cross-country runner presents for an open reduction and internal fixation of a non-united ankle fracture. Despite immobilization for 8 weeks and administration of paracetamol, ibuprofen and codeine in appropriate doses, the patient complains of severe pain in the foot. The foot is cool with smooth skin and obvious allodynia and hyperalgesia. The most likely diagnosis is E. Complex regional pain syndrome (CRPS) type 1G8. You are called urgently to an in-hospital cardiac arrest. On arrival, the team leader tells you the patient is asystolic in the 3rd cycle of CPR. A 1 mg mini-jet of adrenaline was administered down the ET tube a couple of minutes ago due to the lack of IV access. You manage to site a cannula. What is the most appropriate next step? B. Administer adrenaline 1 mg and continue CPR. C. You are asked to review a 4-year-old child who is brought to A&E by his mother. She found him with an open box of aspirin tablets on the bathroom floor. She immediately brought the child to hospital, but it is now approximately 2 hours since the event. The child has vomited once and is pyrexial. His mother believes there are 28 missing tablets. Which of the following investigations would best allow you to immediately assess the severity of the overdose? A. Plasma salicylate levels. B. Blood gas analysis. C. Which of the following statements regarding neuropathic pain is true? A. Sensitization of nociceptors is a known mechanism of neuropathic pain. B. Sensitization of nociceptors is a known mechanism of neuropathic pain. B. Sensitization of nociceptors is a known mechanism of neuropathic pain. B. Sensitization of nociceptors is a known mechanism of neuropathic pain. Sensitization of nociceptors is a known mechanism of neuropathic pain. B. G11. You are called to urgently review a 35-year-old lady who is intubated and ventilated on the ICU. She was admitted following a high-speed road traffic collision in which she sustained head, chest and lower limb injuries. She has acutely desaturated to 80% on FeO 2100% and has become cardiovascularly unstable. Whilst reviewing her notes, you notice that she has not been prescribed low molecular weight heparin and consider a diagnosis of acute pulmonary embolism. Which of the following would be the next most suitable investigation to confirm this? E. Transthoracic echocardiogram. G12. A 45-year-old man has been removed from a furniture warehouse fire with signs of smoke inhalation and superficial burns to his legs. On arrival in the emergency department, he is breathless and drowsy. Initial arterial blood gas analysis demonstrates a profound metabolic acidosis with measured carbon monoxide levels of 12%. Which of the following diagnoses and initial treatments is most appropriate? D. Cyanide poisoning -100% oxygen. G13. A 20-year-old male patient intubated and ventilated on ICU following a head injury requires brainstem death testing for potential organ donation. Which of the following statements is true? D. Caloric tests must be performed bilaterally. You are asked to anesthetize a 48-year-old lady, with a history of cirrhosis of the liver secondary to chronic hepatitis B infection, for an incarcerated umbilical hernia. She has signs of portal hypertension with ascites and splenomegaly. She has a hemoglobin of 8.6 grams per deciliter, an inner of 1.6, with platelets of 80. Her sodium is 129 mol/L, urea is 10.3, and creatinine is 129. Her LFTs reveal a bilirubin of 54 μmol/L, Atlantic Standard Time of 122 U/L, ALT of 98 U/L, alkaline phosphatus of 120 U/L, and an albumin of 26 grams L. What is your main priority for her anesthetic management plan? B. A rapid sequence induction to secure her airway followed by a general anesthetic technique that maximizes hepatic oxygen delivery and perfusion, whilst minimizing hepatotoxicity. A 25-year-old female presents to the pain clinic following a normal laparoscopy. Her complaints include pelvic pain, menstrual pain and dyspareunia for 6 months. Examination is unremarkable. She is taking simple analgesics, but these are not effective. Which diagnosis is least likely to explain her symptoms? E. Uterine retroversion G16, you are performing a preoperative anesthetic assessment for a patient with cirrhotic liver disease due to undergo an abdominal hysterectomy. Which of the following is most accurate? B. A coagulation screen is the most sensitive indicator for the degree of hepatocellular dysfunction. C. G17, a consultant colleague has confessed to an addiction to alcohol. She has been informed by the General Medical Council that her work must be closely supervised by a registered medical practitioner of consultant grade. What is the meaning of closely supervised? B. She must be supervised as if she is a novice anesthetist. Massive antepartum hemorrhage is a major cause of mortality and occurs with a frequency around 7 per 1,000 deliveries. This equates to around 35 cases per year in a unit with 5,000 deliveries per year. Antepartum hemorrhage is dangerous to both mother and fetus. Prompt recognition and treatment is essential. Team working between the specialties, obstetricians, hematologists and anesthetists among others, is important, and a knowledge of the various causes and outcomes of antepartum hemorrhage is vital to effective treatments. E. Bleeding due to placental abruption is generally associated with more pain than bleeding due to placenta previa. The NAP3 study took place to determine the incidence of complications of central neuraxial block (CNB). What was the quoted pessimistic risk of permanent harm or death in the chronic pain population following epidural CNB cases per 100,000? A. 0B. G20, a term baby delivered by caesarean section is pale, blue and floppy. The midwife dries and stimulates the baby. Then she opens the airway but the baby does not breathe. She auscultates the heart rate and it is 50 bpm. What should she do next? E. Give 5 inflation breaths with a self-inflating bag and mask. G21, a 56-year-old man presents for an oesophagectomy for a squamous cell carcinoma. The surgeon decides to do this using a minimally invasive technique. During the laparoscopic part of the procedure, the airway pressure rises from 38 cmH2O to 52 cmH2O. There is evidence of decreased air entry on the left side. The most likely cause of this is D. Pneumothorax secondary to high airway pressures. E. Pneumothorax secondary to high airway pressures. E. Pneumothorax secondary to high airway pressures. E. You are the onco-obstetric anesthetist and you are called to triage to see a primiparous woman at 34 weeks with preeclampsia. She needs a Category 1 caesarean section for fetal distress. Her most recent blood tests, taken last week, are as follows: HD12, WCC 5.6, platelets 80, her blood pressure is 150/90 seconds, she is taking labetalol and she last ate about half an hour ago. What would your initial anesthetic management plan be? General anesthesia with rapid sequence induction using alfentanyl 1-2 mg, thiopentone 5 mg kilograms and suxamethonium 1.5 mg kilograms d. Which of the following is a clinical prediction scoring tool to assess the probability of deep vein thrombosis, DV? B. Wells score C. Wells score C. Wells score C. Although ultrasound is becoming more commonly available, nerve stimulators are still used in a wide variety of peripheral nerve blocks. Correct use of the nerve stimulator increases the likelihood of a successful block and reduces the likelihood of injury to the patient. Which of the following is true? C. Large motor fibers have shorter chronaxy D. You have been asked to review a patient on the cardiac intensive care unit who is bleeding following a coronary artery bypass graft procedure. A thromboelastogram, TEG, to assess the patient's clotting shows, R time 13 seconds, 10-14 seconds, K time 4 seconds, 3-6 seconds, alpha angle 50 degrees, 54-67 degrees, MA 47 mm, 59-68 mm. Lysis 30 is normal. The TEG is repeated with heparinase, and the results are the same. Which of the following products would be most suitable to give in this case? A. Platelets. B. Herbal remedies are often taken by patients alongside prescribed medication. Increased risk of bleeding is one of the effects of some herbal remedies. Which of the following herbal remedies is not known to increase the risk of bleeding? A. Echinacea. B. Echinacea. B. Echinacea. B. G27, a 34-year-old male presents for a shoulder arthroscopy. He is known to have bipolar disorder and is on lithium. He is otherwise fit and well. Your anesthetic plan would include most importantly, A. C. The use of neuromuscular monitoring or the avoidance of neuromuscular blocking drugs. D. Intra-aortic balloon pump (EAB) increases the oxygen delivery to the myocardium and decreases the myocardial oxygen demand, thereby improving its function, especially in heart failure. Which of the following physiological effects are not seen with a well-functioning EAB? D. Down arrow renal blood flow. You are asked to anesthetize a 60-year-old lady suffering from severe refractory depression for electroconvulsive therapy. Which of the following induction agents would enable the greatest seizure quality? A. Prop. B. Etomidate. C. There are many hazards of providing anesthesia for magnetic resonance imaging (MRI). Which is of greatest concern to the anesthetist? A. Limited patient access and visibility. You admit a patient to your intensive care unit and require a venous thromboembolism (VTE) risk assessment as part of your normal hospital protocol. Which of the following risk factors is not commonly linked to increased risk of VTE? A. Congestive cardiac failure. B. Female sex. C. The midwife looking after a 43-year-old, Gravida 8 Afro-Caribbean lady notices she is bleeding PV postnatally. Which of the following statements is most correct in assessing and managing this patient? A. PPH is defined as the loss of 500 milliliters or more of blood from the genital tract within 24 hours of the birth of a baby. B. A 3-week-old baby boy with pyloric stenosis has undergone medical management and now presents for surgery. Which of the following statements is true? C. He is likely to develop postoperative hypoglycemia. He is likely to develop postoperative hypoglycemia. He is likely to develop postoperative hypoglycemia. A patient with lung cancer presents for pneumonectomy. The following investigations most accurately predict suitability for resection. A. D. FEV1 greater than 2000 ml. FEV1 greater. D. FEV1 greater than 2000 milliliters. E. You are called to see a 65-year-old man in the emergency department. He presents with sudden onset of severe chest pain radiating to his back. His ECG shows ischemic changes. His BP is 295 mmHg, HR 110/minutes. His chest X-ray shows a widened mediastinum. He has an urgent CT scan which shows an acute type aortic dissection. What should you do next? A. B. Give titrated morphine IV for his pain. C. Give titrated morphine IV for his pain. C. Give titrated morphine IV for his pain. C. The 8th Report on Confidential Inquiries into Maternal Deaths in the United Kingdom, 2006 to 2008, was published in 2011. Which of the following 5 answers has the leading causes of maternal death from that report in order of decreasing frequency, direct and indirect causes? B. Cardiac, other indirect causes, neurological, sepsis. C. Successful. He has previously. A 52-year-old male is on a dental list for multiple extractions. He has previously had a successful mitral valve replacement 2 years ago and is currently well. He is concerned regarding the risk of infective endocarditis associated with his surgery. What should you inform him? C. Antibiotic. D. Neither antibiotic prophylaxis nor chlorhexidine mouthwash is required, but good oral hygiene should be maintained. A healthy 25-year-old male requires an appendicectomy, with a rapid sequence induction. Following optimal preoxygenation, induction of anesthesia, and an appropriate dose of suxamethonium, your initial 2 attempts at intubation are unsuccessful. The next appropriate step in your management would be, A. Insert a laryngeal mask airway and call for help. B. Perform a fiber optic intubation. C. Release cricoid pressure and reattempt intubation. D. Check the position of the patient's head and neck and reattempt intubation with a McCoy or alternative blade. E. Place the patient in the head down. A. Maintaining oxygenation. H9, the pulmonary artery flotation catheter (PAFC) is used in a variety of areas. Its use lies in its demonstrated ability. A. Perform repeated measurements of hemodynamic data. B. Reduce morbidity and mortality in cardiac Reduce morbidity and mortality. She is known to suffer from myasthenia gravis and has been estimate cardiac out. You are asked to see a 40-year-old woman in the anesthetic preoperative assessment clinic. She is known to suffer from myasthenia gravis and has been scheduled for a repair of a large perumbilical hernia under general anesthesia. You discuss your planned perioperative management with her. Which of the following is not an indicator of a postoperative requirement for ventilation? A. C. Dose requirements of pyridostigmine of 250 mg. H11, a 30-year-old gentleman with a BMI of 30 is listed for open appendicectomy. He denies any other significant medical comorbidity. You decide to perform a rapid sequence induction as he is at risk of aspiration. Which one of the following would best ensure adequacy of preoxygenation prior to induction of anesthesia? A. Maintenance of a patent airway with a tight-fitting mask. B. 25 degrees head-up position. C. Preoxygenation for at least 3 minutes. D. End-tidal oxygen fraction FeO2 greater than 0.9 e. Increasing the FeO2 from 21% to 90%. H12. In the UK, the diagnosis of brainstem death is made following several tests, to be completed by 2 doctors, of at least 5 years GMC registration, on 2 separate occasions. Which of the following actions does not form part of the UK code for the diagnosis of brainstem death? C. Testing of motor or sensory function for each cranial nerve. D. H13, an 80 kg man has been involved in a fire in a first-floor flat. He has escaped by jumping out of a window. He arrives in the emergency department immobilized on a spinal board on high-flow oxygen and has had 1,000 milliliters of 0.9% saline. He has suffered approximately 25% burns. On examination, the airway is patent, but he has signs of smoke inhalation. Chest is clear bilaterally. SpO2 98%. Blood pressure 80/35 mmHg. Heart rate 120/minutes GCS 13/15 M6V4E3. What would be the most appropriate first course of action from the following? D. Take blood for cross-match E. A 42-year-old female presents to the emergency department with a GCS 6/15. She is intubated and ventilated prior to performing a CT scan of the head. This reveals a subarachnoid hemorrhage. On transfer to ICU, the patient desaturates to 88%, despite increasing FiO2 of 1.0. Lung compliance is reduced and CXR reveals bilateral interstitial shadowing. ECG shows widespread T-wave inversion. Troponin I is elevated at 1.4 and echocardiogram demonstrates a mildly impaired left ventricle. Adult demonstrates a mildly impaired left ventricle.